Hello everyone, myself Dr. Sneha Chandrapal, working as an Associate Professor at Anand Institute of Social Work, Anand, Gujarat. My topic for today's presentation is Social Work Intervention in Pandemic. Now let's talk about social work and COVID-19 pandemic. The COVID-19 pandemic is an unprecedented challenge for everyone and social workers are no exception. During these uncertain and difficult times, social workers have been called on to face new challenges and new concerns for service users and for themselves as well. Almost all the sectors and professions got affected by this novel virus. Perhaps the social work profession, more than any other, is most hurt by the rampaging coronavirus and the pandemic situation, which has maliciously impacted the society's underserved and undervalued populations. Social work profession is a helping profession that adopts skills and theories of human behavior and social systems in resolving social problems. Now let's have a look at the roles performed by social workers during this pandemic situation. First is, in the face of racial, gender and ethnic discrimination being experienced by marginalized groups globally, this pandemic globally and especially in developing countries comes with a high degree of stigma and discrimination, especially on the survivors and infected persons. In this regard comes the extraordinary roles of social workers to serve and protect the most vulnerable during pandemics such as COVID-19. Second, a variety of mental health supporting strategies are required in pandemic areas to facilitate the lifestyle changes and readaptation activities required after the occurrence of outbreaks, and this falls within the purview of the social work profession to provide. Third, social workers have the responsibility of playing a crucial and frontline role of helping and supporting communities that are affected by COVID-19. Fourth, social workers must recognize that stigma fuels the isolation of people and blocks access to care and support, which in turn contributes to the continued spread of disease. With this, social workers must step on to the role of creating awareness as well as combating myths about the pandemic, fear and stigma in intense environment. The social work role, given the deleterious invasion of pandemics on families and individuals, is within the healthcare systems as well as within poor households having inadequate or no medical health insurance or lacking the knowledge on how to secure oneself. In light of this, the social worker's role must be that of a counselor, educator, and referral linkage to the healthcare facilities. Next is, older persons are the most at-risk group for COVID-19. Maintaining physical distancing has limited social workers' interaction and care for the older people. Social workers are to explore leveraging on and promoting kinship care and support practices as an alternative mechanism to meeting the welfare of older people. In the case of death of parents or guardians in the pandemic, social workers are to provide safe spaces for children or minors, ensuring that they get proper shelter, healthcare and nutrition. This will eradicate or reduce the psychological trauma that the children might experience because of lack of parental care, stigma, or rejection by other family members for fear of contamination. Social workers' role includes advocating for social inclusion of the most vulnerable sections of the society into the social policy service system in the face of pandemic. Social workers play fundamental roles in emergency response, recovery and preparedness planning for future occurrences, and appropriate professional social work services are to be mandatory in the outbreak of emergencies and pandemics. There has been in the past different levels of unverified messages that has been passed through different media platforms, most especially the social media in the period of outbreaks of pandemic. Majority of these messages are misleading and can cause more harm to the ignorant population. So in this case, effective communication, orientation and educating the public on the pandemic is a very important role that must be played by social workers. This is to keep the society well informed about the true state of affairs as regards the pandemic as well as avoid social disruption caused by fear, rumors, or neglect by appropriate authorities. While performing this variety of roles, social workers also face certain challenges, and this slide throws light upon the challenges. In May 2020, a group of social work academics in partnership with IFSW, that is International Federation of Social Workers, conducted a study to gain an idea of the ethical challenges faced by social workers globally. Some of the major challenges I have quoted here from that study. The first is, it is difficult to create and maintain trusting, honest and empathetic relationships via phone or internet with due regard to privacy and confidentiality, or in person with protective equipment. It is also difficult to prioritize service user needs and demands, balancing service user rights, needs and risk against personal risk to social workers and others in order to provide services as much as possible. Acknowledging and handling emotions, fatigue, and the need for self-care when working in unsafe and stressful circumstances are also some of the challenges faced by the social work profession and social workers during this pandemic. Some other challenges include lack of technological infrastructure. So lack of technological infrastructure is the major challenge in a country like India, especially for those who belong to rural and remote communities where there is lack of technological infrastructure to support consistent high-speed internet. Another challenge is for some client populations such as homeless, children, older adults, there is no access to virtual services and facilities. Next is some type of therapeutic modalities are inappropriate for virtual care where face-to-face contact is very much required. Apart from all of this, doing community engagement work is also considered more difficult to do virtually. Thus, it can be concluded that social workers play a very vital role in the emergency situation such as pandemic. On the other hand, while performing this variety of roles, they also face various challenges. The pandemic has undermined the profession's historical value commitment to social justice and human rights, while overturning our insistence on the importance of human relations. Here is the list of some of the sites and resources which have been referred for documentation. Thank you for patient listening and giving me an opportunity to present my views on the said topic. Thank you.